You are watching Radicon.
MCL runs on the medial side. It is a thin band of tissue extending from medial femoral condyle, quite fairly down, almost to the level of tibial tuberosity or around it. So it's almost stands 7 centimeter below to the joint space on the medial side. So please pay attention more distally as well. And there are superficial and deep parts, but you may not see those bands separately, and the deep parts is closely applied to medial meniscus and superficial MCL. So there are different grades of MCL injury. So grade 1 is sprain of the medial collateral ligament, where you get thickening of the MCL with superficial edema or soft tissue reaction, but the general morphology of MCL is almost maintained, so it's a grade 1 injury. Grade 2 injury is partial thickness tears, so MCL is a bit more swollen, heterogeneous in appearance with signal change within and around it as well, and it's difficult to make out the normal morphology of the proximal MCL. So this is an example of a grade 2 or partial thickness tear. In grade 3 injury is complete or high grade tear or near complete tear, where most of the MCL cannot be appreciated on coronal sequences, and there is surrounding edema and soft tissue reaction. That's an example of a grade 3 injury of the MCL. Next is posterolateral corner injury, which is very important injury to recognize, and as it may involve surgical intervention. Normally the fibulocollateral ligament, which is demonstrated on the left-sided image, it's a thin black low signal intensity structure. It runs between the lateral femoral condyle and extends down, and close to the fibular head it joins the biceps femoris to form a conjoint tendon which inserts onto the fibular head, which you can see on the second image, and it almost forms a V-shaped structure. So that the anterior limb is the fibulocollateral ligament and the posterior limb is the biceps femoris, and it's a low signal intensity conjoint tendon inserting onto the fibular head, which is here. What are the signs of posterolateral corner injuries? So you get injury to the biceps femoris or FCL, and you may see tears of the popliteus tendon or muscle, and there may be hemorrhage and fluid posterior to the popliteus muscle or in the region of the arcuate ligament and posterolateral capsule. You may also get fracture or marrow edema within the fibular head as a result of the injury. So this is an example of posterolateral corner injury. So you can see the arrow points towards an area of marrow edema within the fibular head, and you can see this low signal intensity line traversing it. So this is the fracture of the fibular head. So you immediately know that there has been an injury involving the posterolateral corner. There's a lot of subcutaneous edema. On the second image, you can see there is a signal change within the popliteus muscle here with overlying soft tissue reaction, and there is mild marrow edema as well. So this is a case of posterolateral corner injury.
You can subscribe to our YouTube channel and click on the notification bell for new courses. For more modules and Radiology CMEs, please visit www.radicon.org.